Which color tube should be collected first when no blood cultures are ordered? A. Red. B. Green. C. Light blue. D. Lavender. Answer, C. Light blue tubes, coagulation tests, are drawn first to avoid additive contamination that affects clotting tests. What is the additive in a lavender top tube? A. Sodium fluoride. B. EDTA. C. Sodium citrate. D. Heparin. Answer, B. Lavender tubes contain EDTA, which binds calcium to prevent blood clotting. Which additive is found in green top tubes? A. EDTA. B. Heparin. C. Fluoride. D. Citrate. Answer, B. Green tubes contain heparin, used for plasma chemistry tests. After collecting a light blue tube, what comes next in the order of draw? A. Red/SST. B. Lavender. C. Gray. D. Yellow. Answer, A. Serum tubes, SST or plain red, follow light blue tubes in the order of draw. What is the purpose of the additive in gray top tubes? A. Coagulate blood. B. Preserve plasma. C. Prevent glycolysis. D. Increase platelet count. Answer, C. Sodium fluoride in gray tubes inhibits glycolysis to preserve glucose levels. Why must tubes be drawn in a specific order? A. Patient comfort. B. To prevent additive carryover. C. Faster processing. D. Less blood waste. Answer, B. Additive contamination can alter test results if tubes are drawn out of order. Which test is most effective if EDTA contaminates a serum tube? A. Glucose. B. Calcium. C. Hemoglobin. D. Bun. Answer, B. EDTA binds calcium, leading to falsely low calcium results. What is the additive in light blue tubes and what does it do? A. EDTA prevents glycolysis. B. Sodium citrate prevents clotting by binding calcium. C. Heparin promotes clotting. D. Fluoride clots blood. Answer, B. Sodium citrate prevents coagulation by binding calcium ions. Which tube must be filled completely to maintain the correct blood additive ratio? A. Lavender. B. Green. C. Light blue. D. Gray. Answer, C. Underfilling light blue tubes distorts the blood to additive ratio, affecting coagulation results. Which tube yields serum after centrifugation? A. Lavender. B. SST. C. Green. D. Light blue. Answer, B. SST tubes, gold/tiger top, allow clotting and produce serum after spinning. What is the correct order if collecting SST, lavender, and gray tubes? A. Lavender gray SST. B. SST lavender gray. C. Gray SST lavender. D. Lavender SST gray. Answer, B. Serum tube, SST, first, followed by EDTA, lavender, then fluoride, gray. What color is associated with the EDTA additive? A. Blue. B. Green. C. Lavender. D. Red. Answer, C. Lavender tops contain EDTA. Which tube is used for blood ethanol level testing? A. Light blue. B. Green. C. Gray. D. Lavender. Answer, C. Gray top tubes preserve ethanol and glucose with fluoride. How many times should a lavender tube be inverted after collection? A. 1 to 2. B. 3 to 4. C. 5 to 6. D. 8 to 10. Answer, D. EDTA tubes must be inverted 8 to 10 times to prevent clotting. Which tube type follows blood cultures in the draw sequence? A. SST. B. Light blue. C. Lavender. D. Gray. Answer, B. After sterile blood cultures, the light blue tube is next. A green tube is collected before a serum tube. What error could this cause? A. Low glucose. B. Falsely elevated potassium. C. Reduced calcium. D. Delayed clotting. Answer, B. Heparin in green tubes may contaminate serum tubes and affect electrolyte testing. What does the gel in an SST tube do? A. Clots blood. B. Stops bacteria growth. C. Forms a barrier between serum and cells. D. Inhibits glycolysis. Answer, C. The gel rises during centrifugation and separates serum from blood cells. Which tube is inappropriate for calcium testing? A. Green. B. Lavender. C. SST. D. Red. Answer, B. EDTA chelates calcium, making it unsuitable for calcium measurement. Which tube contains an anticoagulant that directly inhibits thrombin? A. Light blue. B. Green. C. Lavender. D. Gray. Answer, B. Heparin in green tubes inhibits thrombin to prevent clotting. A phlebotomist collects a lavender tube before an SST. What might occur? A. Inaccurate white blood cell count. B. Falsely elevated serum potassium. C. Excessive clotting. D. Delayed serum separation. Answer, B. EDTA from lavender tube may contaminate SST and falsely increase potassium levels. What test is most likely to be affected if a gray tube is collected before a lavender? A. Platelet count. B. Hemoglobin. C. Glucose. D. Hematocrit. Answer, C. Additives in the gray tube can affect glucose if drawn early. What happens if a red tube is drawn before a light blue tube? A. No impact. B. Coagulation test error. C. Increases ESR. D. Lowers sodium. Answer, B. Coagulation tubes may lack sufficient anticoagulant if not drawn first. Which tube comes directly after SST in the correct order? A. Lavender. B. Light blue. C. Green. D. Gray. Answer, C. After serum tubes, green, heparin, is next in the draw sequence. EDTA effects which analyte the most? A. Bun. B. Glucose. C. Calcium. D. Sodium. Answer, C. EDTA binds calcium, significantly lowering test results. Which additive is most likely to prevent clotting the fastest? A. Heparin. B. EDTA. C. Sodium fluoride. D. Sodium citrate. Answer, A. Heparin acts quickly to prevent clot formation.